Okay, it says we're live tonight for District Dialogue. Good evening, Sandites. Thank you for joining us tonight. I hope you can hear me. I want to introduce our team that's present today. First, we have Ms. Kristen Arnold, again, Assistant Superintendent of Human Resources. And then I'm really proud to have on tonight our school nurses. So we have Lindsay Sinkville to my left, your right, and then Janelle Wright to my right. And so they have been gracious enough to take the time to join us on a Tuesday night at 7, which is a little outside of what we maybe should expect, but they're gracious enough to do that. And then tonight we have Ms. Carrie Slayhuber, our special education director, and we all have some pieces of, as we talk about our re-entry plan for tonight, that we're going to talk about. I hope you noticed that we're all donning masks tonight. That's become something that after we finish with revealing or sharing our plan with you guys, we're probably going to take the mask discussion back to the table for sure. Tonight, with Carrie's permission, we are trying really hard to spread ourselves out a little bit more and make sure we're wearing masks because she is immune compromised. And so at some point, she might be willing to tell her story, but out of respect for making sure we stay safe and we're keeping our people safe, we thought it would be a great idea to don the mask tonight. So hopefully it doesn't muffle our voices too much, and we're going to try to talk slow and articulate and project, and we'll go from there. So Sean's sitting in the background. He's going to jump in here in a little bit as well, but we're going to start with a presentation of some slides, as we thought it would be easy for you all to see pieces of the guidance on the screen so you could understand a little bit about our rationale for how we arrived where we arrived. So he's going to go ahead and start that screen so we that need some help with eyesight can see it pretty big. I'm not ashamed to say that glasses are my friend. So anyway, just a little bit about where we've been. You all probably understand that school was out May the 15th. And as soon as that was out, we began to work as a leadership team to really wrap our mind around how school might start up for the 2021 year. We have a leadership team that's been very gracious about meeting sometimes twice a week, but definitely weekly, to help us kind of figure out where we wanted to land. And then graciously, these two girls sitting beside me have been key components of really keeping track of CDC recommendations, the Tulsa Health Department, our Oklahoma State Department of Health. And then, of course, we also relied on our Return to Learn document from the State Department of Ed. So these girls have had a lot of work to do, probably a little bit of stress that go around trying to make sure we're keeping our students and staff very safe. So we're going to get into the slide show, which will really take you into pieces of the document. Again, that will be posted hopefully in the morning. We've got some cleanup to do a little bit on it, but we're going to try to get that on our district website. So in the first slide, we really broke up the sections into 4 parts. The first part deals with employee guidelines, and this is one we went over with our entire staff today in a Zoom meeting at lunch. It took about an hour and 45 minutes. People hung with me and really tried to get lots of questions answered regarding what startup look like for employees. And that's going to be, we may save that topic for another time, just because tonight I think our goal really is to get through operation guidelines and student guidelines more so than the other two. And then just Tad will touch the student health and nurse's office guidelines as well. So I'm going to start with the first section. I will definitely ask for these fabulous girls' help when we kind of get into the nitty-gritty. But basically, with students, one thing that we want to make sure people understand is that we are asking you to keep your child home if they are sick. Let us know that it is okay to be absent from school. I think that parents get really hung up and not hung up. It's a good thing. You want to be at school. I know our accountability system, Ms. Arnold, really does keep track of chronic absenteeism and I know Ms. Arnold kind of tracks all of our data throughout the year, but you guys, in this season that we're in now, we know flu season will absolutely start come late fall, early winter. We would just ask for you to really monitor your students' health at home, and if they are sick, please keep them at home. We're recommending that you take their temperature before coming to school every day. I know that's a big ask. Let me tell you a little bit about what our employees have been doing all summer long. We have 12-month employees that are still working right now. And as these guys will attest, before they come to work, they take their temperature and we log it in a Google form and we send it. We're not asking you to log it. We're just asking you to please take the temperature to make sure it's within normal range, which lends itself to the next bullet. According to CDC, they consider a person to have a fever when he or she has measured a temperature of 100.4 or greater. So we want you to keep your children at home until they're fever-free for at least 24 hours without medication. Janelle, I believe that's a practice that we already have in place.
We do,
correct?
yes,
okay.
Correct.
According to our policy. And so then when they are fever-free for 24 hours without medication, then notify us. And when you come to school, we'll have, our goal is to have an appointed person that will handle kind of the nurse's aide position at every school site, assess the student to make sure they're cleared to come to school. We, at this point, will not be providing masks to students. However, notice that the last bullet is in yellow. You probably are going to see masks for your child on a school supply list, along with things like hand sanitizer and Clorox wipes, all those good things that we know we're going to need to make sure that we keep things clean and safe. Right now, and we'll talk a little bit about why, but students are strongly encouraged, and at this point, our guidance says not required to wear masks. Sean, go ahead and flip to the next slide. I thought it might be helpful for you to see the information from the CDC website. Obviously, we want to teach and reinforce the use of cloth face coverings, and that's how the CDC refers to masks in their guidance. But basically, the highlighted area says face coverings should be worn by staff and students, particularly older students, as feasible, and are most essential in times when physical distancing is difficult. We wanted to highlight that because really, as we were constructing a plan a month and a half ago, that made sense to us in terms of strongly recommending versus mandatory. And of course, I'm sure that you as viewers are well aware that Oklahoma and other states across the country, their numbers are rising. And we've had some pretty robust conversations, honestly, amongst ourselves about how maybe we need to reconsider. And so we're going to be talking through that back in committee next week. Lindsay, I don't know if I'm going to put you on the spot, but you actually talked to me maybe yesterday morning and you called, or I think you called me. And do you recall the conversation?
I don't know. We've had a lot of conversations.
I know, right? But you kind of said, maybe we should rethink.
Yes. I mean, just as like she's saying, this is such an evolving situation that, what is good practice one week, things evolve and change, and it's different the next. So we're just trying to stay on top of what is the most accurate and try to consider, what's safe.
Sure. I will say other districts are coming out with their plans. Many are choosing to strongly really mandate face coverings for students and staff, honestly. So we're starting to see that. I do know, it's my understanding the city of Tulsa, the city council will be meeting tomorrow to consider an item on their agenda that would make it mandatory for masks in the city of Tulsa, mandatory inside city limits. I talked to Mayor Jim Spoon, and I'm just going to do a shout out today to our city and their staff. We actually met with a group of officials from the city talking through how we're doing in Sand Springs and kind of what the state of the city. And I know Mayor Spoon had indicated that there probably will be an item on their city council agenda later this month, in fact, the 27th of July, in order to consider some sort of ordinance possibility that involving masks. And so really kind of looking at this idea of us being very respectful of each other and as a unified group taking care of the public health. So again, masks are a little bit on the table again. You'll see that as this is posted to our website tomorrow. That will be highlighted in yellow because, again, this is a draft that we're just kind of laying out for you guys to see tonight so that we can have some good discussion. And again, we got lots of feedback from our entire staff and our association. And I'm messing with my mask, and I understand that was a huge no-no, so I'm probably going to get in trouble before the night is over with. So keep going, Sean, if you don't mind. So student guidelines, I'm going to shift a little bit. Actually, let me just finish this slide if you all don't mind. Certainly we'll stop talking here in a minute. But just basically, you know, common sense stuff. Individual students, we want them to avoid close contact. So that's defined by the CDC as less than 6 feet apart and greater than 15 minutes at a time. And so when possible, we all know that in a school setting, sometimes that's tricky. Because kids love to be around each other, they love to play, they love to talk, they love to be with their friends, and so we're really trying hard to encourage individual students to not do that. We want them to cover cough or sneeze in their elbow or a tissue and follow with hand hygiene. Some of these practices, I don't know, you guys seem so super simple to me, but as we've learned over the last few months, we don't just say that, they really are pretty intimate in keeping us all healthy. And so
I think I heard Lindsay call that, was it vampire?
Yes.
What's it called? The vampire,
Yeah,
cough,
vampire.
sneeze.
it's
Anyway.
funny. I think kids actually really learn that stuff pretty readily. And honestly, this can be a very teachable moment, I think, for students. So we're going to encourage routine hand washing. Every 2 hours is suggested. If it's not practical to wash your hands, then we're going to be providing hand sanitizer. We need some help. We've ordered a whole bunch of that, no doubt. But at the same time, I'm pretty certain you're going to see that on the school supply list. Kristen is always kind of that person that will alert us to who has it and who doesn't. So you might talk about that a little bit, Ms. Arnold.
Well, it's usually on the list anyway, especially for elementary. We ask kids to bring it and we just go through it, especially when flu season rolls around. But this year, because of COVID, and we will have flu season again also, we're just asking that if you can, bring those supplies, make sure that we have that. And that way the teachers are kind of stocked up in the classroom, and the district will be supplying some. But when you've got 5,000 students in a district, and actually it's a little over 5,000 and all of our educators, it's just really important that we keep that on hand to make sure that our hands are staying clean and that we're keeping things.
So we can buy it now. Like, we're learning that Walmart really does have stock.
Yes.
Best time to target is first thing in the morning, just FYI. And they're not limiting how many, I don't think anymore, of Clorox wipes you can buy. So there's kind of tricks to the trade about how to get those supplies for sure. We're also going to highly encourage students to bring their own water bottle to school. In our new building at the Freshman Academy and some of the places at Charles Page High School, we've actually converted the, I'm really excited about this one. I know you guys laugh at me, but the water fountains to the fill-up bottle.
I'm excited.
So fun. But in our elementary schools, that's not going to be the case. And so I don't know if you guys have ever experienced a line of elementary kids at a water fountain, particularly if they're little. Yikes, that's all I'm going to say about that. So it would be really helpful if they could bring their own water bottle to school, even at the middle school and high school level. And then to the extent possible, we're asking students to avoid large gatherings and adhere to rules of traffic flow in the hallway. Tougher, we know, at middle level high school, but certainly our elementary sites have that down to fine art. Sean laughed at me. I said, bubbles and DuckTales. And he looked at me like, what are you talking about? But that's really, really a thing.
Tina doesn't either. Okay.
You don't know what DuckTales are? Tina is, yes, well, that's the thing.
It's a secondary teacher.
Where you
Right.
catch a bubble in your
You catch a
mouth so you're
bubble.
not talking.
And you put your hands behind your
Put
back.
your hands behind your
It's the
back so
same
you're not
version.
bothering others. So.
It's awesome.
Hey,
So
it
Lindsay,
works.
I'm going to shift to, if you don't mind, talking about student guidelines. Can we do that? Oh, wait. Sorry about that. That would be Sean. So Sean, you want to jump in, or are you going to talk from over there?
I can talk from over here.
Okay.
I'm assuming that I'm heard well enough from here. So, as we said earlier, if students are sick, they do need to remain home. So what you might be asking is, how will we continue to handle learning while they're at home? So, as you may know already, we have had some training back in March for our teachers to conduct distance learning and continue to teach online. And we're going to continue to support our teachers by providing more training next week, actually. We've strengthened some of our guidelines using Google Classroom, but we still have other tools at our disposal, such as Edgenuity and Calvert Learning, that come through our virtual academy. But there's two ways that we can look at this, and we will, as always, continue to support all of our students through their educational process. But knowing that some kids may be sick for the short term, if there's a short-term absence, that can be handled on a case-by-case basis, in which the child continues to receive their learning from their classroom teacher using Google Classroom. I know that our Director of Special Services, Carrie Schlehuber, will be working very closely with teachers to make sure that all accommodations on IEPs and 504s are still maintained. But if it's a short-term absence, we'll continue to do that through our Google Classroom platform. If a student has to be out for a much longer time, for a long-term absence, then we would direct them to our Director of the Virtual Academy, Jay Roeder, so that they can be set up on Edgenuity, so that they can maintain their learning in more of an asynchronous manner if they're definitely ill for a long period of time. So
I think it's important to talk about too, Sean, here, that you're talking about students whose learning could be interrupted because they are quarantined. So they may be asymptomatic.
yes,
So they can continue to learn at work through some sort of offsite learning model.
absolutely.
But they just have to quarantine because they've had an exposure. We'll talk through that a little bit. But Carrie, you might mention, if you don't mind, a little bit about our virtual academy and how IEP accommodations and instruction could happen even if a family would choose to take a full-time virtual option.
Well, the great thing about students on an IEP is that we have always been individualizing their education. So that doesn't change just based on the circumstances that are happening right now. So what Mr. Roeder and I would really look at is, will we be able to handle that student on the virtual platform, or would it be better to move that student to like a home-based service delivery? So for example, I'm just going to throw one out there. If your child is a 5th grade student and they maybe go at Angus to Miss Hayduck for a little bit of resource time, we can absolutely transition that kid seamlessly to the virtual platform. If you have a student who maybe has really significant medical issues, maybe they're nonverbal, or maybe their cognitive level is very decreased, we're going to talk more about doing home-based services with them, where their teacher of record, who is their current classroom teacher, is going to stay their teacher of record and is going to be providing distance learning just like we did from March to May.
So those decisions, Carrie, would be made by an IEP team.
IEP team, absolutely.
And of course, in partnership with the family and the parent. One of the things that our teachers were asking, is it still going to be appropriate to do IEP meetings via Google Meet or in a virtual format?
Yes.
And tell us your discovery here.
Right. So one of the, I'm going to say silver linings, one of the great things that we figured out during the distance period of time, we had some participation from parents that really have trouble getting into our building, whether it's their schedule doesn't accommodate, they can't get off work, you know what, they don't have transportation, whatever that reason is. We had really high success rate of parents showing up on Google Meets to have IEP meetings. And so we'll talk about visitor, procedures in a little bit, but one of the things that I really want to make sure people understand, one of the things that we learned is that you can hold a really effective face-to-face IEP meeting without being in the same room.
Sure.
So we were all face-to-face and we were all able to put everything out on the table that was important for that child, but we didn't have to be in the same room together. So that's a thing we're going to carry over
Right.
into, and I have some teachers that are like, can we do that forever?
It may not stop. I mean, I
Right.
think we're going to learn some tactics and some skill sets. You know, Sean could probably go on and on about technology that would be applicable for ever, that would be really good to continue. I know Tina's over there really want to talk about the Chromebook technologies. We start talking about going. She's shaking her head. No, she really does. When we start talking about full-time virtual, we do have some good news. One of those struggles that we had, Tina, in the spring was hotspots and making sure we had enough technology. So could you enlighten everyone on?
Absolutely. So there's really two big updates in terms of the technology and its accessibility from home that we have. And one of those is that barely by the skin of our teeth, because order times are horrible right now, but we are going to be able to move forward with the full one-to-one Chromebooks at 3rd through 12th grade. So you look to your site principals to be hearing about how that's going to work for your school site relatively soon, but that way we can have that technology, we can use it at home and at school, and we're not cross-contaminating with classroom sets of Chromebooks, which is what we've had before. So we are looking at full one-to-one, 3rd through 12 take-home Chromebooks, which I know that's also scary for some people. So I'm sure at some point I'm going to get dragged on camera to kind of talk more at length about that and how that's going to work for you and your child.
She wants to
definitely
do
will.
that. She does.
But the other exciting piece of news is, as of yesterday, we now have in our possession 500 hotspots that we're going to be able to check out to families and students that maybe don't have home internet, and that was one of the barriers that we really struggled with this spring. So it's going to be an exciting new world of technology for all of our Sand Springs students, and if you're a parent that terrifies, it's okay. We're gonna help make it as painless as we possibly can, and your students are comfortable with it, even maybe if you are not. And that's something else we really saw this spring. We had more than one teacher tell a frustrated parent on the phone, just hand the device to your student. They've got this, and they really do. So we will definitely address that at a later time.
So I'm going to put you on the spot again. Very briefly address K2.
K2. Okay, so K2, obviously Chromebooks in the traditional sense with a regular Chromebook are not the desired method of delivery. Just basic things like their tiny hands are not big enough for a keyboard. You know, those kind of struggles. So we are working on getting some 2-in-1 touchscreen Chromebooks that have both traditional Chromebook and touchscreen capabilities, because most of our district apps and services are all applicable through a Chromebook as opposed to an iPad. So I know that's probably a question. Typically people see iPads with younger kids, but we don't have very much curriculum that's iPad compatible, and iPads are super expensive to both purchase and then maintain. So this is something that's going to be a little more fiscally reasonable as we move forward, but we're working on getting touchscreens for our little ones.
Fantastic. And I think we're going to get there, which is good. One of the questions we had a couple weeks ago is, if I go full-time virtual, do I get a device? And the answer was yes. I think I might have answered that on our Facebook page. So,
And I think we answered that during our meeting with Mr. Roeder a couple of weeks ago. Yes, but definitely they will get a Chromebook.
Right. Okay, so the next part, Sean gets total credit for this visual. So Sean, you want to talk about that for a little bit?
Right, so we were talking about the different types of learning options, and in actuality, what you're seeing here between the traditional option, the virtual option, and the blended option of learning is something that we've been doing for many years. Students have the option of a traditional face-to-face learning environment when they come to school. They've also had the option of full online virtual since 2011. But we also have a blended learning option, which means that students can attend school for some things such as extracurriculars, or maybe they want to take calculus on campus, but they want to take the rest of their classes online. And what this visual does is it kind of answers some questions about what kinds of services in the school building can students and parents expect from each of these learning options. In actuality, there's really not that much that anyone misses as far as services that are offered. As you can see here, And no matter which option you choose, you're going to still have access to teachers, a high quality learning environment, but also when it comes to the full-time virtual option, you have tutors that you can take advantage of in our virtual academy lab, but you also have access to our counseling staff to help students along their learning path.
One of the questions we got from an elementary student's parent was, in the blended model, can I do most of my instruction at home, but I'm really interested in accessing Project Lead the Way?
And yes.
And so the answer is yes.
Yes.
We have some very highly skilled teachers that teach those STEM type classes at the elementary level. So the answer is resoundingly yes. So it really is about customization of a learning plan for every kid, every student.
And if you have questions about any of these learning options, whether it's virtual or blended, contact our virtual school director, Jay Roeder, at the email address that's shown here. So
Perfect. Okay, so moving on a little bit, we're going to talk a little bit about student health guidelines, and I can't remember who I said was going to. Is that Lindsay?
Lindsay.
Okay.
Me. So yeah, one thing we can guarantee is that somebody is going to get sick during the year. So, and we're just hoping that most of the time it's not going to be COVID-19, and we're going to treat them very differently. So for common symptoms requiring absence, that would be, your student that gets sick, vomits, or has diarrhea at school. These are all things that are already in place in our policy and that we've been doing for the past forever. So you cannot return for 24 hours after the last time that the child has vomited or had diarrhea. For common things that treat like bacterial conditions like strep throat and pink eye, they have to have been on antibiotics for 24 hours before they can return. So fever, chills, did I say that right?
You did.
Okay.
Yes.
Fever, chills, body aches, 24 hours without the use of any kind of medication and no other respiratory symptoms before they can return. And we're hoping that you guys can take them to the doctor as much as possible, to the health department, if that's the way you go. And then requiring a doctor's note if there's other reasons that you may need to stay at home.
And these are typical, right?
Yes.
This is something that we always do.
Yes.
Yes. Go ahead and flip yeah, there you go.
So if a child were to be diagnosed with COVID-19 with or without a positive test, these are the CDC guidelines that we're going to be following. So, they would require all of these, which is that at least 3 days have passed since recovery, defined as resolution of the fever without medication. So no fever without medication, and improvement of any kind of respiratory symptoms, and at least 10 days have passed since the symptoms first appeared. And again, that's what the CDC is recommending.
Perfect.
If a student is diagnosed or tests positive for COVID-19, this is an important one. Any sibling or student living in that same household will be required to quarantine for 14 days.
There's a note that says refer to the employee guidelines because we specify. So basically the employee guidelines are much the same.
Yes.
Correct? Okay.
Yes. So yeah, I think that's just important that even if that other sibling isn't showing any symptoms, that they're still going to be required to quarantine for that 14 days. And again, that's what the CDC is telling us to do.
Right.
Yeah.
And so if you think about, we're going to have to communicate a little bit because we could have a family who has a student at Angus Valley, but also at Charles Page High School and maybe the Freshman Academy. And so it'd be really important because we're going to talk, I don't know if we get to the close versus near exposure, Lindsay, but assuming that kids live in the same household, I think it's safe to assume that there's probably close contact.
Yes.
Yeah.
Yes.
So notification parents, Ms. Arnold, I'll let you talk about that. You get a lot of parent phone calls regarding just things that are going on. So if you could talk about that, that would be great.
Certainly, it's really important for us to be open and share that information, but you also have to remember that we work under guidelines related to FERPA. So if for instance, we really got to think about student confidentiality and also for our staff. So if any site within Sand Springs Public Schools learns that a student or students are out sick due to COVID-19, it may disclose information about the student's illness. So we won't be sending out a specific name a teacher or of a student, because we need to protect them, other students in our school and community. And so we would have to have parental or an eligible student, meaning 18 years or older, that they give that information out. That's the only way that we would do that. Parents will be notified, though, if a student or a staff member tests positive in their child's classroom. However, students' names and employee names would not be given. It would just say that your child, or has been in contact with someone that tested positive for COVID-19, and then we would move forward with that.
Correct. We want the goal is to be as transparent as possible so that you can make choices about self-quarantining your child as well, and to allow you to make the decision maker in regard to your child's health. And so we want to make sure we're very transparent in that we have a known exposure to someone who's out because they're sick with COVID. So again, parents will always be notified, minus the actual student name and teacher name. So thank you, Ms. Arnold.
But I also want to caution too that just in case your child comes home and says, well, little Carrie Schlehuber had COVID-19, and I know it was her because, they took her out and she didn't feel good today, that, you want that protection for your child. You wouldn't want that out, that it was your child. And so I just caution parents in, being respectful for teachers and also for our students if there is a COVID case, that we're not sharing through social media or whatever, because it's not something we wouldn't put out. So therefore, I just hope that we keep student names out of it.
I think too, it's important to say that we're going to be communicating with the health department to
100%.
And they're going to be doing contact tracing and things like that. So people that are really at high risk will be being notified by them, is my understanding.
Yes.
And that we will be communicating with them.
I will say I have to also give a shout out to the Tulsa Health Department. Dr. Bruce Dart is the primary kind of guy in charge. Very smart. He answers a cell phone. We ask people to report. No, that's a big deal, you guys.
Yeah.
He asks people to report to me specifically in case of a COVID positive case, mostly because they don't want everybody in the district calling the health department. That would be terrible. So we're really really constant communication if need be, and he's really great about answering the phone and helping us get guidance. So very excited about that. Notice we're kind of shifting to school operations for now. And I'm going to let Carrie, if you don't mind, talking through.
Sure. So one of the big things that we've really talked about in terms of bus guidance is that if you really do have the ability and the opportunity to bring your child to school, this would be the year that we would love and appreciate that you do that. Because if we can get the numbers down on the buses, that makes it a little bit easier for us to keep children a little further apart. We know that not everybody can do that, but we know that there are a lot of you that probably really could. And so that would be really important and really helpful to start the year. When it's feasible, the windows are going to be open on the bus. Again, just to help with that fresh air and outside air. Buses are going to be sanitized after every route is completed. And students, we're going to ask them to social distance to the extent possible on the buses. And then once again, we've got the highlighted part about masks, because as Ms. Durkee has said, we really are taking that back to the table after hearing some feedback from people that we really, appreciate their input. So.
Right. Here's another thing that they suggest. I know siblings probably don't like to sit together on the bus, but as we try to keep students together who already have common exposure all the time, it would be helpful for siblings, if possible, to sit together on the bus as well. So just try to keep people safe. And by the way, our staff are seeing 2 new bullets here from what we shared with them earlier, just so they know, because we know social distancing is a thing, and we also know mask is something that we want to continue to talk about with our committee. So thanks, Carrie, for that.
Keep going. Okay.
Sure.
As far as the building guidance goes, in classrooms, we are asking teachers to have desks and tables facing the same direction so that students are facing the front of the room.
Whenever possible.
Whenever possible,
Yeah, that was
absolutely.
So you might talk about the kind of different seating we have in some classrooms.
Sure. Well, and we know this is a shift because so much of education has been about, having flexible seating and kids can move from space to space. But for this time period, we're asking that the safest way for kids to sit is going to be facing the front whenever possible. Obviously, we know, like in a lab, you're going to have a science lab classroom where that's not necessarily going to be the case. And so we're going to maintain other social distancing guidelines when we can there. Restroom breaks should be in small groups, and elementary teachers are already the kings and queens of this, so they will be able to make that happen seamlessly. Restrooms should be sanitized frequently, at least once per hour. I think now's a good time to shout out Mike Bynum and his staff for everything that they've been doing to prepare us ahead of time for this return to school. So there will be disinfectant wipes in the classrooms, and faculty and staff are going to be asked to routinely wipe down frequently touch surfaces like door handles and light switches. We're going to use disinfecting wipes to clean electronics as opposed to spraying them directly, or spray the Virex onto the cloth, then use as directed. So, and then we are going to, as much as possible, we're going to discontinue using shared school supplies. This is not the year that we can just have community crayons. So everybody's going to have their own crayons. And as Ms. Durkee said, if you bring your Rose Art crayons, you're going to have to use your Rose Art crayons. And
That's
then
a real thing.
Oh, I know. Yeah. If supplies do have to be shared, though, that they will need to be wiped down between usage. And so this is really going to be up to teachers, and our teachers in our district, their number one priority is to keep your child safe. And so just know that those things are going to be taken care of in the classroom. And then site principals will notify the director of maintenance if an employee tests positive or suspected to have COVID-19, so that the employee's area can be sanitized before the next school day or as soon as possible.
So Janelle, they get endless emails from me. It is funny how vendors seek out an opportunity to sell stuff based on need. And sometimes the prices aren't that great. So what I've done is I've forwarded email after email of, can you talk about that for a second? Because I know it's got to be driving you guys crazy. What are we on the hunt for?
Oh my gosh, hand sanitizer, Clorox wipes, everything. Thermometers has been the big thermometers.
That's been tough just because it's hard to get medical grade because they were really at short supply. And so making sure we were getting ones that to the greatest extent possible would actually test the temperature accurately. What else? Masks.
Gloves.
But PPE, right?
Yeah.
Absolutely. So they've been very patient with me in terms of ferreting out all those, vendors that want to sell us things. So large groups. Janelle, you want to talk about that?
Again, our highlighted masks, strongly recommended, but not mandatory. And then to the extent possible, we're going to avoid large group gatherings over 250, which has been a number that the CDC has always thrown around, and no longer than 15 minutes, as advised by local, state, and federal guidelines. We're going to have students report directly to their classrooms upon arrival if necessary. I know a lot of them will congregate in gyms or outside. Outside's probably,
That would work.
that would work.
Right.
But just going to try to get them to go onto their classrooms. That's still something we're working on.
That's right.
Avoid congregating and intermingling homeroom classes. So that's at the elementary level. Just try to keep the homeroom classes together. Students may eat in the cafeteria. We're going to keep that number down to 250, which elementaries go by classes. So I don't think that's going to be a problem. We've talked about high schoolers going off campus.
And we're not planning to change that practice. So juniors and seniors are already off campus, which means that sophomores and freshmen remain at the school to eat. So we have 2 eating areas now. The freshman they have a nice, big, expanded space that seats well over 250, as does the high school. I believe the high school cafeteria seats around 400. And so we think that we're going to be able to manage that with more than one lunchtime with our high school folks. And then middle school is going to be a little tricky. Again, multiple lunch periods, making sure we're getting kids in and out in a decent amount of time. And between groups,
Our cafeteria tables will be cleaned and disinfected, which that already gets done in our cafeterias. Assemblies at all the levels are going to be kept to a minimum, if held at all, until further notice. That's still something we're discussing.
we had a conversation today about pep assemblies, and I know Carrie Slater is ex-cheer coach, and so that's heartbreaking. And I have to tell you, we grieve honestly at some of the decisions we're making. There's no doubt, because that we all look forward to that. So just know, in kind of this idea of starting up school in a healthy way, minimizing or trying to mitigate the risk, there are some changes that we're going to have to make, and that's one of them. So thank you, Lindsay.
I'll take this one.
You
Okay.
take it.
So visitors and volunteers. So earlier, Ms. Durkee kind of mentioned like on the bus, and just kind of families kind of staying together. And honestly, I don't know one educator or any of us that don't think of the kids that are in our site as family. So I mean, we consider those kids to be part of our family. So in looking at this, we really want to keep our family and try not to have a lot of visitors that are coming in and out of the building. And I know those of you that are watching, and we've had this conversation too, like if your family's with you and you're out and about at Walmart or wherever, you might have a tendency, if somebody didn't have a mask or it was like a big group of a family that you didn't know, you kind of hold your breath when you walk past them, or you shuffle past them really quick, or a big family on an aisle. And so with that said, we have to look at it like this is our family, and we want to lessen the exposure. So with that said, buildings will be secured at all entrances to prohibit entry into from the public. And so we just can't have people coming and going out the front doors. Volunteers may be allowed to enter buildings on a limited basis with prior notice and site administrator's approval. So you're just going to call in advance if you need to visit. Temperature and screening information are required and will be logged upon entry into the building. So there'll be like a little setup where that happens when you're initially brought in. Approved volunteers are required to wear a mask while in the building. I'm not going to go into detail again, but you notice that is yellow, so we're still working on that one.
I will say this, Ms. Earl, I think that's one we probably won't budge on. As we were having our meeting last week with a few parents and some teachers, a comment was made. I know we're going to get close to running out of time, but I think it's important for us to say all we need to say. So if we run over the 7:45 time, hang with us if you can. I understand if you can't. But that idea of keeping our unit safe, and the idea that any exposure that is not a common person coming in every day, meaning an employee, is somebody we don't know potentially. And so I feel like that one's going to really stick in terms of making sure we're keeping people safe, because we don't know their background as readily as we do our employees. And employees have this, we pay them. And we know there's a higher degree of basically expectations maybe for our employees to report. And so we really try hard to be that family and we take care of each other. So thank you.
And the next one, no parents or family members will be allowed to accompany their students into the building at any time, including meals, drop off, and pickup time. And I know that's really hard, especially if you have a pre-K or a kindergarten student this year. We've all been through that. But I promise you, they don't cry very long, and the teachers get them going. And even if they do, they're going to call and let you know when they're doing better. So I promise moms, dads, it'll be okay. School parties will be suspended until further notice. We don't want to suck all the fun out of school, but we also know that there's a lot of parents that are in and out of our building that are bringing food, and we really can't control what that looks like. So school parties suspended, school assemblies at all grade levels would be limited to students and staff only until further notice. And think back to that original like 15 minutes and less than, or 250 or less. So large school events held in instructional buildings. So we kind of went over that a few minutes, and site leaders will follow the guidelines to the best extent possible. If held, optional extracurricular events. So we're talking about those parents have kids in athletics, band, choir, plays. I mean, the list just goes on and on. What is that? GoBots? What's the bots thing? I mean, I can't even hit them all. Yeah, there you go. That are attended by patrons will be managed by the designated department leader. And so we want to keep our kids safe at those. And the last one, to the extent possible, these optional events will follow health guidelines for large group gatherings.
We just held graduation. I've been using that as an example for a while. We held 3 very successful graduations, thankfully. I will say patrons entering those events, those are optional, and patrons are entering probably knowing that you're assuming some risk for going to, say, a football game. Just know it's hard to regulate that. And so as we learned at graduation, even though we tried maybe ineffectively to clearly mark off seats, probably could have maybe done a better job, but people were really social distancing. It's something we can't control. So just kind of understanding that those optional events, we're going to try really hard to follow those CDC guidelines, but if we have them, patrons are coming at their own will. So I know we're running a little bit long, but I really wanted us to get to the visitors and volunteers. So very quickly, I know, do you mind taking that one? We wanted to kind of go over the fact that we do have procedures for how we disinfect. So Lindsay, you might just kind of hit the high points maybe with that one.
No.
Yes.
Right on the right.
Right. End of the day, disinfecting procedures. This is where we're going to ask our faculty and staff to, they already clean at the end of the day, but they're going to be in charge of a little bit more. We're going to have disinfecting guidelines. Where and when possible, we're going to open doors and windows to allow extra ventilation in, and that's providing security, weather concerns. We're going to secure the location before leaving. This is like, I guess, for our own classroom in the building.
Exactly. One of the examples at the high school, as custodians are cleaning the buildings, actually hang a sign on the door, sanitize, and basically that's a message that says, I've cleaned this one.
Right,
So
so stay out till tomorrow.
Don't enter it. So that kind of thing.
Sanitize all manipulatives. These are more of the little elementary
Pre-K type.
pre-K things they play with and learn with. Gloves are going to be available for all of the tasks in the cleaning process. Virex is what we've been using for years. It's a safe product and it works on all kinds of
Effective, right?
germs and infective. And it's a one-step cleaner disinfectant. So we can spray it, let it sit. And by the time, like Mr. Bynum said, by the time you spray one desk and work your way around the room, it's ready to go. There's no extra cleaning there.
Right.
We're going to read and follow all the labels for teachers. They're going to have the directions to use for the Virex. The Virex will be used on hard, non-porous surfaces. Disinfectant is most effective if allowed to stay on 10 minutes, as I just said. After the 10 minutes, we're going to wipe the surfaces to dry them and remove any of the residue. We're going to use wipes instead of spray on electronics. And we're going to spray the cloth, not spray directly on the electronic device. And wash your hands with soap and water.
Right. The obvious one, right?
All right.
Okay, I think we might be down to the last slide that we're going to cover tonight. Let's go there. So this is nurse's office, and I don't know that we need to read this directly. Definitely when we put out the guidance tomorrow, you'll be able to see that. But just understanding that as we are planning for quote-unquote triage areas in each of the sites, meaning that we're planning for the possibility of having a number of students that need to be assessed at the same time. So I would rather overplan, and maybe that doesn't come to fruition versus underplan. And so just kind of an assurance that we are going to keep that area as clean as possible and sanitized as well. You'll be able to read that in the guidelines. And Sean, click on over. This might be employee next.
Just that there's
Yeah.
a specialized place where they're going to go.
So go back, Sean. Yeah. So we wanted to really cover those two areas. So student and operations, just to give you an idea of what our team and our committee have been working on for some time. I can't tell you how many hours, honestly, that we have spent grueling over wording in many, many, many of the areas. We think that we have a solid plan in place. And again, have a little bit of time prior to school starting, which is, by the way, the 18th for students. Our staff are set to come back on the 13th. But guidance that guides our ability to hopefully maintain and mitigate some of the health concerns that you have. Big highlight, though, as Sean was talking about, options for choices for students. There's always a virtual option. Just one little caveat I would say to that before we go is that if you have this idea in your head of how distance learning look like based on the spring, you need to just remember that we're going to be way more robust and we're going to follow standards, we're going to deliver instruction, and there's going to be this level of accountability for students. So I know we ran a little bit late tonight. We didn't get an opportunity to answer many questions, but it was important. I feel like that we got through the document, the sections that we wanted. Likely in the next couple of weeks, we'll be having some of our site leaders come in and really talk about application as they've tried to construct how that might look in our buildings. And actually, Rod Sitton has volunteered to come and be on camera. I'm throwing him under the bus right now to come and talk about student activities at some point before school starts. So I want to thank this team. We have an amazing group of educators that love your children, that want the very best for them, and are committed to deliver the kind of instruction that we are known in Sand Springs to deliver. So thank you for watching tonight. We are always around to answer questions. And so just reach out to any of us and we will try to meet your needs. So thank you for joining us tonight.
They can't see me smiling.